Good afternoon and welcome to H360 Live. My name is Dave Duplay and I'm joined in the studio here this afternoon with my good friend and colleague, Miss Courtland Long from Healthio360. Courtland, how are you?
I'm well, Dave. How are you?
Well, Courtland, the weather has finally turned on us, and we have been talking about being so I guess I don't want to say out of the woods, but the last few months we've been talking about how mild the temperatures have been all through December and the first half of January. The temperatures here in New York City were unseasonably mild and not even a flurry until Saturday, and then wow, what a storm we got.
Yeah, we got all of winter in one day, just a total smackdown winter storm. Jonas really showed us who's boss.
Yeah, Jonas laid some record-breaking snowfall in parts of Central Park and across the state of New Jersey and New York. The governors declared a state of emergency, so it was really tough out there. And now we're here and back in New York City, back to work, but we're digging ourselves out. And wow, the cars that we saw on the way to work today that were blocked in by the snow, there's a lot of work left to be done, but the temperatures are going to jump up into the 40s. I feel like I'm a meteorologist here. Going to jump up into the 40s, and it's going to be fine.
Yeah, hopefully all the warm weather will kind of help people dig their cars out and everything.
Absolutely. Well, we have an exciting show for you today. Dr. Likhterov from Mount Sinai, Beth, Israel, is going to be coming in and joining us. And Dr. Likhterov is an oncologist. He specializes in head and neck surgery. And so we're going to have a very exciting show. We're going to be talking about thyroid cancer and thyroid conditions. And this is where he's spending his career focusing on this. And it's a fascinating topic. Can't wait to get him in here into the studio. But Courtland, first, as you know, we've got some health tips to discuss. And this is part 2 of the health tips that we started last week. As you all remember, we gave you the first 3, and now we're going to move on to the second 3. But just to refresh your memory here, the first 3 were winterize your workout. And Courtland, we talked about that, winterizing your workout. Eat your way upbeat was the second one we discussed, and I'm not talking about red beets either. We were talking about
omega-3 fatty acids.
Very good. Omega-3 fatty acids and whole grains and oatmeal to keep yourself going, and that's a good thing in the morning time in the winter. And then the last one was get your group on, and that's getting your friends together during the winter and either going to a reading class or a cooking class or getting out with your friends. And exercise class is a great way to help manage your weight, get some exercise, but do it in a group. So now we have the set of the next 3, which, given the weather, we're winterizing our tips here. So Courtland, kick us off with the first one.
Well, I think that the health tips we shared last week really helped a lot of people get through this winter storm. I had a lot of friends who were sheltering in place on Saturday together, so they were getting their group on, although, being safe and staying inside. And I think that this week's tips are going to be just as excellent as well. So tip number 1 is to relish winter's pleasures. Do you remember how fun winter used to be when we were kids? We'd go sledding and have snowball fights, build igloos, and then you come back inside and you have hot chocolate and it was awesome. Well, bring all those things back. When you really take the time to savor the most amazing things about this season, it's really going to help you be more content. When you enjoy something rather than dread it, that sense of optimism is really going to overtake the negative thoughts.
That's a good one, and I do remember that, the snowball fights, the igloos. I grew up in Ohio, and you grew up in Illinois, and the lake effect. Now, I was in Lake Erie, you were
Lake Michigan.
Lake Michigan, yeah. So
we were getting snow a lot like this.
We got snow like this all the time. This was commonplace, and we could handle it. The plows were out. We had a snow blower and did the drive and all that. But I do remember those fun times sled riding with my brothers and sisters in the snowball fights and building snowmen out in the backyard. That was a lot of fun. Yeah. I'm not so much into the snowball fights these days, but Courtland, my son and my daughter are really winter sports fanatics. They both snowboard. My son Chris, of course, has been out to Mount Hood snowboarding with the guys from the X Games, so he is really into it. And Chris, if you're watching this, remember, I know you're at Sugar Bush. Wear the helmet, respect the mountain, always. But the second tip is dress for the winter, And so, Courtland, I think you do this very well. I noticed today when you walked into the office, your very nice winter snow boots that you had on. And I noticed a couple of things. One, they looked very warm.
They are.
2, they looked waterproof.
They are.
And 3, on the bottom, they looked like they had a lot of tread, so that you had good stabilized footing, so you wouldn't slip.
Oh,
so
yeah.
those are the kind of boots you want to have. So you have to dress for the winter. And so starting with your feet, you got to invest in some boots that are going to keep your feet dry, warm, and have good traction on the bottoms. Moving up, you want to have a good set of heavy pants in the wintertime, maybe some wool pants to keep your legs warm, and then, Courtland, a parka is a staple,
Yes.
right? You got to have a good heavy winter jacket. A parka that is maybe a little longer is best. The wind whips around in the city here, so a parka is a great thing to invest in. And then, of course, there's a couple things that are must-haves. Number 1, gloves. You got to have a good pair of gloves. You got to have a warm scarf always, and you got to have a very, very warm hat that protects your ears and the sides of your face. Now, I'm not talking about one of those silly Elmer Fudd hats either. You can get a nice, good quality wool stocking cap or a ski cap that's going to really, really keep you warm. So tip number 2 is dress for the weather. Feet, boots, important gloves, scarf, hat. You got to be prepared.
Yeah, you really do have to be prepared, and it does take a little bit of an investment. Dave, I know that we've been talking a lot about winter wardrobes, and you've been kind of in the market for a Canada Goose down parka, and that is really the top of the line. It's definitely going to keep you warm, but they are really expensive too.
They are, and I was not one of those lucky ones that hit the lottery when it got up there so high. So I may hold off. There's a couple things, Courtland, and here's not a health tip, but here's a good tip for our viewers. The winter months are here, but in retail, they're beginning to put the spring fashion out. So now you're going to see some of the winter coats and scarves and gloves be pulled back, right, and be replaced by the spring outfits. So you might be able to shop around, get a good buy, because you're going to, take advantage of some sales. Are going to try to move the merchandise and get it out so they don't have to return it.
Yeah, hopefully those sales will be good.
Yeah.
Well, tip number 3 that we have here is see the light. Now, our bodies produce vitamin D when your skin is exposed to sunshine. But in the winter, the sun's rays are actually a little bit too weak to reach us here, especially in the northern part of the U.S. And so vitamin D can actually serve as a little bit of a mood booster. So if you think you're getting a little vitamin D deficient, talk to your doctor about incorporating a vitamin D supplement into your diet, and that will really kind of help bring up your mood a little bit. And also maybe invest in a light box and sit with that for about 10 to 15 minutes every day to help increase your serotonin levels as well.
Now, Courtland, is that opposed to a heavy box?
No, a light box that gives you, a simulated sunshine.
I'm just toying with you. Now, you brought up one really important point.
Only one important?
Oh, well, there was more than one, but one I'm going to focus on because it's something that we talk about all the time. And, so we are talking about vitamin D. Now, I say this every chance I get. Before you start a supplement regimen, see your doctor. Before you start a workout regimen, see your physician. Get a checkup. Make sure that your physician authorizes those supplements that you're deficient, and your doctor will be able to tell. Maybe a small blood test, they can run some labs, do the work, and really pinpoint what you need. So before you jump into going to Vitamin Shop or any of the other ones, GNC, check with your physician, because you may not need that, but only your physician will know.
And some supplements can interact with your prescription medications, so definitely talk to your doctor.
Bingo. Point number, well said. It's something I forgot, but that's why we make such a good team.
Yeah.
All right, so Courtland, now, as we always do, we sent the interns out into the fields to Bryant Park to see what our friendly New Yorkers know about winterizing themselves and preparing to get through the 2016 winter months. You want to watch the video?
I would love to.
Okay, guys, please roll the video.
During the winter season, do you try to enjoy the season's pleasures, such as drinking warm beverages, going ice skating, or even wearing cozy clothing?
Yes, as you can see, I'm all bundled up right now. I have some instant hot chocolate in my drawer right now at home.
Yeah, I enjoy them. I like ice skating. I like watching people doing it too. I like I like the warm beverages. My favorite beverage is coffee.
Lots of ice skating.
Yeah.
Yep. Snowboarding.
I do. I love sweatpants and pajamas and sitting by the fire, and I love hot cocoa.
So I know in the wintertime, some people feel a bit sluggish because of the cold weather. So they have to bundle up in layers and things of that nature. So do you bundle up when it comes during the wintertime?
I mean, look at me. I got like 8 layers on you. Yeah. And look at him. Yes.
Yeah, he has a lot of layers.
Definitely. You got to.
Yeah, definitely, and especially like long johns and like Under Armour and stuff. Underneath is really helpful.
Yeah.
You could tell that not a lot of people like being outside, and not a lot of people go out during this time of year.
Yeah, because it's cold.
So I think it's more of a being lazy state.
I do tend to get really lazy during the winter because I just like to be warm and cuddly. But because I live so close to a gym, I've been trying to stay active that way.
Okay.
So, but yeah, generally I don't like going out when it's really cold out at all.
Do you take any extra supplements such as vitamin D or even B12 just to help you throughout the winter season?
No.
No.
I just drink a lot of coffee.
You just drink a lot of coffee?
A lot of coffee,
Okay.
yeah. It helps me out.
It helps you
yeah,
out.
especially I'm in college right now, so
It helps you stay awake.
it helps me staying awake, especially during this time of year. It's New York, you gotta stay active.
Yeah, you do.
Generally I don't. If I feel like I'm getting sick, I take Emergency. I have
Yeah.
like 2 giant boxes in my room. But other than that, not really.
I think I would have in the past. Yeah. Now, I definitely take a multivitamin, so I hope that gets
there's,
everything. But
everything
yeah.
in one time.
Sure, definitely. Because, there's less sun, so you
Yeah.
feel a little bit less, kind of.
Yeah, I'll take vitamin C or Airborne if someone around me is sick, especially if like a
Okay.
roommate or like my parents or something if I'm at home.
Well, Courtland, what'd you think?
Well, that was a great video. Of course, our New Yorkers don't disappoint. And I was really excited to see that a lot of them really enjoyed, winter activities, snowball fights, ice skating, and of course, everybody had something good to say about hot chocolate.
Oh, well, who doesn't like a
Yeah.
nice, mug of hot chocolate in the winter months? And that guy that brought up, he wears long johns or
Yeah.
Under Armour
Yeah.
in the wintertime. He must have watched our layering show,
He must have.
right? Because he's putting the layers on, so that was good. You remember the old Union suits?
No.
No, the old Union suits. My grandpa Duplay used to wear this Union suit, and it was like a onesie for an adult. It was like underwear, but it was a onesie, and it buttoned from the waist up to the neckline, and that's kind of how you got in it. It didn't have feet. There were no footsies, but and you got into it, and then it had a little thing in the back around your behind, with buttons, and if you had to go to the bathroom, you unbutton it, and that kind of flap went down. It was called a Union suit, and I don't think they make those anymore, but I specifically remember as a kid, Grandpa Duplay walking around, in the Union suit. And
Oh, my.
yeah, they've gotten away from that. But you know what? Our interns did a phenomenal job. Our New Yorkers didn't disappoint. We had some great conversation there, so thanks to them. Well, Courtland, our favorite time of the show, Dr. Likhterov is making his way into the studio right now. And just to give you a little background about who Dr. Likhterov is, he is a surgical. He focuses on the surgical management of the thyroid and parathyroid disease, advanced management of all head and neck, including upper cancers, oral cavities. He is board certified, and he is a fellow of the American Head and Neck Society. Dr. Likhterov, thanks for coming in and joining us today.
Thank you for having me. It's a pleasure.
Now, you are a New Yorker, not originally, but you live in New York now, and you said you made a snowman over the weekend.
That's right.
Yeah, we got hit by this big storm, so you were out in it and having a little fun, as some of our tips suggested.
Got to make the best of it.
You have to make the best of it, absolutely. So I am so anxious to have this discussion because it seems to me in my research the thyroid controls a lot of things. And it's a gland right below the Adam's apple, if I'm not mistaken. And so I'm interested to hear all about it. So let's jump right into the conversation.
Yeah, the thyroid is a gland that produces a hormone. It's part of the endocrine system, and the endocrine system has a lot of glands within it. But what is most common is they produce a hormone that goes into the bloodstream and then affects a whole variety of cells. Now, thyroid hormone, which is produced by the thyroid gland, you can think of as a foot on a gas pedal for using energy in the body. We want to maintain a constant speed of metabolism, which is the use of energy. And when we go too fast, that's hyperthyroidism, meaning the heart starts beating fast, you start sweating, the heat becomes intolerable, weight loss, anxiety. And then when you slow down, or hypothyroidism, all the systems slow down as well. And the thyroid, as you mentioned, is in the center of the neck under an Adam's apple.
Well, Dr. Likhterov, can you explain to us what are some of the most common thyroid conditions?
So there can be growth of the thyroid or a goiter. There can be little nodules within the thyroid nodules that are very common. And then there are other conditions, autoimmune conditions like Graves' disease and Hashimoto's thyroiditis.
And as I understand it, there's also thyroid cancer, is that correct? So how common is thyroid cancer, and does it affect one population more so than another?
Thyroid cancer is becoming more and more common. In fact, it's one of the fastest growing cancers in the United States, and we'll talk about what some of the reasons may be for that. It does tend to affect women more commonly than men. Thyroid disease in general, and thyroid cancer included, tend to run in families. And patients who have been exposed to radiation in the past, so patients from Ukraine, Chernobyl, or patients who've had a lot of radiation as part of treatment, are at risk.
So let's go back to the hyper and hypo. So if the gland is overproducing, that's hyper. And so what would cause that? What's, is it diet? Is it, what causes hyper?
So the way the thyroid gland knows how much hormone to produce is it's controlled by a pituitary, which is a gland at the base of the brain, and the hypothalamus in the brain. And when those glands sense that there's too little thyroid hormone in the bloodstream, they tell the thyroid, hey, you gotta do a little bit more. And there's a whole number of reasons why that feedback loop may be interrupted. And also there are things that affect the thyroid gland directly. So for instance, Graves' disease causes hyperthyroidism because it tells the thyroid to produce more hormone. Hashimoto's tends to destroy thyroid cells, so there's less hormone production.
So can you explain to us what are some of the symptoms of an underactive thyroid? I know when you said a hyperactive thyroid, your heart starts to beat really fast and you might sweat a little more than others. So what does an underactive thyroid do?
Because it's part of the endocrine system and the hormone is in the blood, you can think of hypothyroidism as affecting every single system in the body. So from the nervous system, depression, fatigue, the motor system, muscle weakness, weight gain, inability of the body to go through the building blocks quickly enough. I mentioned depression is one of them as well. And then the thyroid gland can start to grow.
So you mentioned this thing called Hashimoto's disease. What specifically is that?
Hashimoto's is a type of a disease we call autoimmune disease. So the immune system is supposed to protect us from foreign things in the body, bacteria, infections. When the immune system gets confused and starts attacking self, these are called the autoimmune diseases. And Hashimoto's is one of them. There's an antibody, and an antibody is essentially a soldier of the immune system that goes out and tries to find things that are foreign. Well, in Hashimoto's, the antibody thinks the thyroid is foreign. And so it attaches itself to the thyroid cells, and then the cells get destroyed by the immune system. And Hashimoto's is the most common form of thyroiditis, which is inflammation of the thyroid. And at first, there's a burst of thyroid hormone as the gland is becoming destroyed and the cells are breaking apart. And then as more and more cells become destroyed, the thyroid becomes less active and you become hypothyroid, where you're not producing enough thyroid hormone.
And how common is Hashimoto?
Hashimoto's is very common. It is the most common condition affecting thyroid. And again, just the pattern with thyroid disease is it more commonly affects women.
And is Graves' disease the second most common thyroid condition? And what really happens when you're living with Graves' disease?
So Graves' disease is another very common autoimmune disorder. Again, the immune system thinks this thyroid is foreign, but what happens there is the thyroid gets tricked. The antibodies in Graves' disease are similar to the protein that actually tells the thyroid gland to produce more thyroid hormone. So you have these antibodies that attach themselves to thyroid cell, and the thyroid starts producing excess thyroid hormone. So it is the most common cause of hyperthyroidism. And as these antibodies also tell the thyroid glands to grow, make more thyroid hormone, and the thyroid becomes enlarged, so you can develop a goiter as part of the Graves' disease condition.
Well, it's a good lead-in. So a goiter. I was, doing my research before you came in, and can you tell our audience what is a goiter?
A goiter is a medical term. It means growth of the thyroid. And there's a whole host of diagnoses and pathologies that can lead to a goiter. But a goiter, as a term, just means an enlarged thyroid. Now, Hashimoto's disease can cause a goiter. Graves' disease can cause a goiter. Iodine deficiency can cause it. And a goiter doesn't necessarily mean that the thyroid is enlarged and producing a lot of hormone. A goiter can be enlarged thyroid that's producing not enough, producing too much, or producing just the right amount of thyroid hormone.
Well, there are also thyroid nodules. So let's talk about those for a minute. How do you develop thyroid nodules? And I think you said that they affect women more so than men. So why is that?
The thyroid nodule is a term that describes any little growth within the thyroid. And the thyroid nodules tend to look a little bit different from the remainder of the gland. They can be filled with fluid, they can be solid. Some of them are cancerous, very few, about 5%. Majority of them are benign, meaning not cancerous. There's a number of reasons why they may develop. It has to do with the control of the thyroid function. It may have to do with previous exposure to radiation. The question of why women tend to have more thyroid disease, I think, has to do with the overall hormonal balances that occur in women.
So a lot of what we're talking about is related to the endocrine system. Endocrinologists really focus on this. You're specializing in thyroid cancer. So let's turn to that for a minute. I think that maybe only 4.5%, maybe 5% of the thyroid are cancerous. Tell us a little bit about that. When technology with ultrasounds and scans are commonplace, right? And so when you sit down with a patient and the patient hears those 3 words, you have cancer, a lot goes through their mind. And when you're looking at that and you're sitting with the patient, sometimes the recommendation of the doctor is we're just going to observe it. We're going to watch it over a period of time. And that's really not, we think of cancer and we think, uh-oh, I've got to do something immediately. It's got to be aggressive, get this thing out of my body. But sometimes that necessarily isn't the case.
So thyroid cancer encompasses a number of different pathologies, meaning different diseases. The most common type of thyroid cancer is called papillary thyroid cancer, and the second most common is called follicular. These 2 cancers are called well differentiated, meaning even though the cells have lost their normal growth and their normal function and have now spun out of control as cancer cells do, they still regain some features of the thyroid cells. And luckily, those thyroid cancers have excellent prognosis. There are other types of thyroid cancers that are more aggressive, specifically medullary thyroid cancer and anaplastic thyroid cancer. The most common, as I mentioned, is papillary. And so what you're referring to tends to relate more to papillary thyroid cancer. Again, a cancer more common in women. As you mentioned, the chance of a nodule being cancerous is about 5%. But with the technology you're describing, ultrasound, we're finding more and more of those little small nodules. And as they're getting biopsied, some of them are cancer. And so the question becomes, well, now we found a cancer that's within the gland and that's less than a centimeter, let's say. Is it warranted to have thyroid surgery? And there's really good data out of Japan that looked at large populations of patients with these small cancers and chose to observe them. Did these cancerous nodules grow? Did they cause problem in the future? And the answer is that is a safe approach to a very specific select group of patients. Specifically, patients with a thyroid cancer that's smaller than a centimeter, that is not near a border of a thyroid where its growth can cause any significant problem. And that is a viable option that should be discussed with those patients. But again, with a different diagnosis of medullary thyroid cancer, anaplastic thyroid cancer, or even a larger papillary thyroid cancer, this idea of active surveillance or observation should not apply. And that's where the discussion with the surgeon or with an endocrinologist comes into play about what strategy is right for the patient.
So, Dr. Likhterov, although thyroid cancer is rare, it is on the rise. And when we were talking with you before the show, you said it's actually one of the fastest growing cancers. Now, is this because we're finding, there are actually more cases, or are we just having much better and earlier detection, like you mentioned, these ultrasounds that maybe are picking up things that, we maybe shouldn't really treat?
A little bit of both. Primarily the rise in thyroid cancer, or papillary thyroid cancer specifically, is because more and more people are getting imaging. So whether it's a CT scan, ultrasound of the carotid arteries looking for clots, these little nodules show up, they get biopsied, and then we're faced with what to do. In fact, they implemented doing ultrasound screening on everybody in South Korea, and they noticed that their incidence of thyroid cancer jumped up tremendously, exponentially. Now, while there's more thyroid cancer, the death from thyroid cancer has not changed. And what that means is we're diagnosing more and more of small cancers that may not have caused significant damage if they were not found in the first place.
So you said at the beginning when you sat down that the thyroid's a gland and it produces a hormone. And then, so tell me about if you have to remove the thyroid, then how do you get that? What's the hormone replacement strategy for that patient?
Sure. So we don't always have to remove the entire thyroid, even if we have to do surgery. We can remove half of the thyroid, and then the other half is sufficient to produce enough hormone to maintain normal metabolism, normal energy consumption. If a total thyroidectomy is done or the entire thyroid gland is removed, we have great synthetic thyroid hormone that can be taken as a pill every day, and when it's balanced out, the dose is balanced out by the endocrinologist, the patient's energy level is maintained, and this can be monitored through blood tests, and the patients do very, very well.
So a big thing in medicine these days is genetic testing. We're hearing about this more often for women with breast cancer, for individuals who have hereditary colon cancer. So is this something that's coming about in thyroid cancer? Do people do genetic testing for this condition as well?
Absolutely. There's a number of tests. A cancer, by definition, is a mutation within a gene. For thyroid cancer, there's a number of genes that become mutated. And so if we can find those mutations through genetic analysis, we can predict a number of things. For instance, when you have a nodule, the question becomes, is it cancer or not? We take a small needle, we sample a couple of cells, and the pathologist looks at it under the microscopes and sees if the cells appear abnormal in shape. Well, sometimes it's not black and white, sometimes they're not sure. And so this is where genetic testing can come in and help us say, well, this type of cell has enough mutations to say this is cancer or not. And also genetic testing can help us predict, well, if it's a small thyroid cancer, is it likely to grow? Is it likely to spread to the lungs? Or is this the type of cancer that can be observed and can be monitored with ultrasound for years to come?
Yeah. Well, Doctor, this has been a fascinating discussion, and I really appreciate you coming in and sharing this with our audience.
Thank you for having me.
Yep. We'd also like to thank our audience for tuning in, and we always want to thank our sponsors for making this all possible. Remember, all of our episodes can be viewed on demand at healthyo360.com, and our podcast can be found in the iTunes Store. Well, Courtland, we're all about social media, aren't we?
Absolutely. We love social media, and we're all over Facebook, Instagram, Twitter, and Pinterest, and we use the hashtag #RealStories when posting. We'd really appreciate it if you would do the same. On behalf of Dave Duplay, myself, and the entire Healthyo360 family, we'd like to thank you again for joining us today, and we look forward to seeing you again next week when we're chatting with Pete and our favorite cancer advocate, Mark, about surviving esophageal cancer.